evening, everyone, and welcome to today's webinar organized by yours truly, TDR Global Asia. We are excited to have you join us as we discuss an important topic, addressing the health needs of people with disabilities and why they face greater health challenges. My name is Agitiara, and I will be your host for today's webinar. People with disabilities often face such significant barriers to assess healthcare, and we are here today to discuss this challenge and the potential solutions that can perhaps bridge the gap. And I would like to begin by welcoming our participants. Thank you so much for coming today, including our healthcare professionals, disability advocates, public health officials, researchers, students, NGOs, and anyone else interested in making healthcare more inclusive. But first, let me introduce TDR Global for you. TDR Global is a worldwide community of passionate scientists and experts who have been working with TDR on research on infectious disease of poverty. We have covered very significant range of this infectious disease in poverty. And if you're interested to know more about TDR Global, please scan the QR code below. And if you are keen to join the membership, we have a TDR Global profile, and we also have the newsletter for you if you're interested in joining our very, very interesting community of researchers and scientists and people who are passionate about the tropical disease. Okay. So I would like to introduce our esteemed speaker today to kick off today's sessions. We have a very special speakers today, Mbak Luthfi Azizatunnisa. She is a lecturer and researcher at the Faculty of Medicine, Public Health and Nursing Universitas Gadjah Mada, Yogyakarta. She has an extensive experience in research, disability health, and her insights today will help us better understand the disparities faced by people with disabilities and the strategies we can use to address them. She is now here with us in this Zoom meeting. Now, without further ado, I will hand over the platform to Mbak Luthfi. Mbak Luthfi, thank you for being with us today.
Hi, my pleasure.
Hi. How are you today?
I'm good. Thank you so much.
Thank you so much for being able to share your insights today. Please take the floor away today. Thank you so much. And everyone, enjoy the session.
Thank you. Can I share my screen, please? Thank you. Is it visible? The
Yes,
slide?
yes, we can see you.
Okay. Thank you so much, TDR Global Asia, for having me here to discuss important topic that us health professionals need really know about disability. So as introduced, my name is Luthfi Azizatunnisa. I'm a faculty member at the Department of Health Behavior, Environment and Social Medicine, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. Before I start, probably I need to explain more about my background. So I am myself a person with disability. I am a wheelchair user due to spinal cord injury, cervical level. So my condition actually that drives me being passionate about research on disability. And I'm doing my PhD at the London School of Hygiene and Tropical Medicine, focuses on the health insurance access among people with disability in Indonesia. So this is the outline of today's talk. We will discuss about disability and then health disparities experienced by people with disabilities, and how can we make health system and healthcare service more inclusive for people with disability using the existing framework. And if the time allows, this is optional, I will present my initial finding on the health insurance among people with disabilities in low middle income countries. So let's start with disability. I am sure, I believe that most of you already know about disability, but let me just state that the UN Convention on the Rights of Person with Disability definition about disability. So persons with disability include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. So the highlight here is the long-term impairment and the interaction with various barriers in the society. So the disability theory is evolving. So previously it is medical model that saw people with disability as someone that needs to be cured, and then it started shifting to the more social, and then now biopsychosocial model with um, the definition from the WHO with the International Classification of Function model. So basically, disability is interaction between the health condition and also the environmental factors and personal factors. I will give an example. So for example, for my condition, I have spinal cord injury, which cause I have difficulty in my mobility. I have paraplegia here, and then due to the barriers in the society or in the environment, for example, like inaccessible building or inaccessible transport, and in interaction with my personal characteristics such as gender, age, or race, it can cause a limitation of my activities, and also it hinders my participation to access education or work. How can we solve or address these barriers to provide more accessible environment for people with disability? Let's take a look for this example. So this is the example of my condition, spinal cord injury. It can be adjusted for any other impairments. We can have here the assistive device, accessible transportation, and learning agreement for education as intervention. So we provide assistive device, for example, wheelchair, accessible transportation that can be accessed by wheelchair, and learning agreement in the education institution that accommodate the need of people with disability at school, for example. And then this promote my independence. So using wheelchair and there is accessible transport, I can be independent. With this independence, this can improve access to education, and those improve also the employment rates. So this model creates interaction between the impairment itself and the barriers in the community. So if we can remove the barriers, I believe that we can also improve the access for people with disabilities. So why the issue of disability here is important? Um, First of all, every person has the risk of being disabled. At least all of us has chance to be old, and if we are old, we most likely experience decreasing function of our body. That's why every person here has the risk of being disabled. And then many health conditions lead to disability. For example, now the NCDs, diabetes, cardiovascular disease, or osteoarthritis, or any other NCDs may lead to disability condition, or accident can also lead to disability. That's why all of us have similar risk, have risk to develop disability. And people with disability globally comprise of significant proportion of the population. So according to the WHO report, there are more than 1 billion people with disability globally. It is approximately 16% of global population, and 80% of them living in low middle income countries. And also they are more likely to live in poverty. So people with disability tend to have poor health outcome through different pathways. First of all, because of their primary health condition, because of the disability, they can develop poor health. For example, with the disability condition, and they cannot access the healthcare they need, so their disability hamper them to access healthcare, and when they need, they cannot access the healthcare. Therefore, it can lead to poor health. And disability related condition, and also the secondary health condition. For example, me as a wheelchair user, I sit on my wheelchair for so long, and I may develop pressure sore, which is secondary health condition, or urinary infection tract as a secondary health condition. And if it is not addressed well, it may develop worse, and it can lead to poor health as well. People with disability have increased health risks. For example, like me, using wheelchair, sedentary lifestyle, and lack of physical activity, probably I am more at risk to develop NCD, and yeah, probably lead to poor health. Delayed diagnosis, for example, it's often happened to me when I need healthcare that is not related to my disability. For example, I have fever or headache or stomachache. I go to Puskesmas or primary healthcare, but what the health workers first ask is about what happened to my legs. So sometimes the diagnosis shadowing probably happened to us because of our disability. So they tend to see our disability rather than what the health concern we have at that time. Stigma, negative attitude, discrimination is still exists. Yes, some often people with disability are seen among population that they cannot do anything for themselves, and they depend on others, and they cannot do, or they cannot think or decide on their own related to the health care use. And yeah, this negative attitude is still exists in the health facilities. Therefore, it hampers us people with disability to access healthcare and may lead to poor health as well. We often excluded from information and access to preventive care. For example, our friends who have sensory impairment, for example, who have vision impairment or who have hearing impairments, and they cannot access the health information that provided by the healthcare services. For example, like during COVID-19 pandemic, that so many information and health education existed, but the health system did not provide accessible format for them, so they faced challenges in accessing the information, and they probably were more vulnerable to contracted to the virus, and therefore lead to poor health. And these are the probable pathway from disability to, in the end, have poor health. The health status of people with disability itself, um, we face more risk to develop poor health outcome. For example, we are more likely to have diabetes, more likely to have HIV, more likely to be malnourished, and more likely to experience serious illness as a child, more likely to experience catastrophic health expenditure because we have more health needs, we use more healthcare facilities there, but sometimes the existing financing scheme or the insurance does not cover our healthcare needs. Therefore, we need to pay out of pocket, and therefore we are more likely to develop catastrophic health expenditure. And from our umbrella review in building disability inclusive health system, we also found many discrepancies that people with disabilities experience. For example, like we are less likely to receive breast cancer screening, cervical cancer screening. We are less likely to receive prenatal care, and more likely to have adverse pregnancy and postnatal complication, lower coverage of reversible contraception for women with disabilities. We experience poorer patient safety outcomes and lower vaccination rates. And from all this inequity and discrepancy, people with disability therefore have triple healthcare needs. First, it is related to general healthcare. So we have general healthcare needs like other people in the population. For example, like for promotion, we need prevention, we need curative care when we need it. And then we also need specialistic health service related to our disability. We need rehabilitation and also assistive technology. And because of our condition, we are also vulnerable to poor health condition and prone to develop secondary health condition. Therefore, people with disabilities have higher healthcare needs, higher healthcare utilization, and also higher health expenditure compared to those without disabilities. So here again, I remind us all that disability with this pathway can develop poor health. And because of we tend to have poor health, so there is also life expectancy gap that is identified from 12 countries. This referred to the Missing Billion Report 2022. You can see here in Indonesia, we have the life expectancy gap 9 to 15 years, meaning that people with disability live 9 to 15 years shorter compared to those without disability or general population. And it is translated to median cap life expectancy globally. So in general, on average, people with disability live 14 years shorter than those without disability. And with these all discrepancies, we face more barriers to access healthcare. So actually, we have higher healthcare needs, higher healthcare costs, but still we face also greater barriers to healthcare compared to those without disability. So I think I don't know how multiple burden that we bear just to access healthcare. Actually, we share similar barriers as everyone, like long queue, transportation costs, complex administrative procedures for like referral care. But for people with disability, we have more than these barriers. And people with disability experience barriers in every step when they want to seek care. For example, related to the autonomy, we are more likely to have like autonomy. People tend to assume that we cannot make our own decisions. So often people or healthcare workers tend to talk to our family member or caregiver rather than to us. Related to affordability, the barrier is people with disability often cannot afford like transportation costs or cannot afford the access to the healthcare facilities. Related to human resource or healthcare workers, there are still stigma and negative attitude existing in the health facilities. And inaccessible health facilities and information related to rehabilitation and service unavailable and unaffordable assistive technology that we need. So we need, like I need wheelchair, but the price of wheelchair is very high, it's very expensive, and it is not covered by BPJS or the National Health Insurance. So we need to pay ourselves to access wheelchair. And I think it is similar to any other assistive technology because in Indonesian national health insurance, it only covers 7 types of assistive technology so far. Related to the governance, it's often program or policy does not consider people with disabilities. For example, when the government develop policy or formulate policy or programs, sometimes that policy or programs is not accessible for people with disability or do not consider the needs of people with disabilities. So we are left behind of that program. We cannot access that program. Necessary care not covered by health insurance, or there is only limited health insurance coverage that covers the needs of people with disability, and unavailable or unreliable data for monitoring and evaluation. This is very important. The data and evidence is very important for like how can we know that our program is disability inclusive if we don't have the data of people with disability? How can we do the M&E if we don't have the evidence or data about people with disability? Therefore, here the data and evidence is very crucial to do the assessment and evaluation. So how can we improve the health system for addressing the needs of people with disabilities? And because it is a bit complex, so we need to help the system that addressing the needs of people with disability. So I refer the framework to the Missing Billion report that developed the framework for inclusive health systems. It is expected that inclusive health service can expect accepted and connected people with disability. So people with disability are expected. The health system expect people with disability to access the healthcare. So it is predictable that people with disabilities someday will visit healthcare service. Therefore, the healthcare services, health facilities need to be ready to accommodate people with disabilities as their patient. Therefore, people with disability can feel accepted in the health facilities with the comprehensive and mindful accommodation and also universal design environment. And in the end, it is also important that after having the health services, they still connected with health facilities with by building the strong health literacy and also maintaining the quality care with people with disabilities. This is the illustration. So, for example, women with physical impairment wants to access maternal health services. So um, she's having access barriers here because she uses wheelchair and the health facility is quite far, and it is difficult for her to propel wheelchair because the transportation is not accessible. Therefore, it is expected that the community health worker or the village health worker can reach her to facilitate her and to bring her to the closest healthcare facilities. And when they arrive at the health facilities, the health facilities are accessible and are ready to welcome this woman with the accessible environment and also the knowledgeable staff to facilitate this patient to access the maternal health care service they need. And then after that, it is important that the information and the health education given to her is understandable and um, can improve her health literacy, and therefore she can be independent in deciding the decision related to her health. And it is also important to have follow-up check with her since she has access barriers. It is important as well to check or to follow up and have remote consultation after visiting and using the healthcare. So the missing billion inclusive health system framework look like this. It derives on the service delivery, which consists of demand and supply, and uh, in the higher level, it it needs the system level governance. So we can go through one by one here. What we need to have in the governance level. So we need to have inclusive health policy, inclusive health program, including the needs of people with disability in, for example, in our health planning or in our health program. In leadership, there is specific task assigned in the MOH or in the health office in different level. Related to health financing, we need to have adequate financing scheme, for example, health insurance to cover the necessary care of people with disability. Related to data and evidence, we need evidence from research and reliable data or the routine data that currently has been collected regularly can be disaggregated by disability status. Related to autonomy and awareness, it is expected that people with disabilities have their own autonomy to decide on their own. And people with disability can afford healthcare access, be it for transportation or any other indirect costs. Related to human resources, healthcare workers are expected to be knowledgeable and can facilitate people with disabilities at healthcare facilities. And the health facilities need to be accessible, as well as the information need to be accessible for different type of impairments. Accessible, available, and affordable assistive product or assistive technology need to be ensured, and also the rehabilitation need to be accessed to cover the health needs of people with disability. And these all are expected to have output on the effective service coverage for people with disability. And at the end, it is expected to improve the health status of people with disabilities. So the key takeaway from my sharing is that people with disabilities have higher healthcare needs, higher health costs, and higher risk of catastrophic health expenditure. And also disabilities are interaction between the impairment and also the environmental and personal factors. Therefore, we need to eliminate or minimize the environmental barriers so that we can uh, boost or improve the independence of people with disabilities. And they also experience greater barriers in accessing healthcare, and it is broaden the gap of what healthcare they need and the healthcare they can access. They experience health inequity as they experience poorer health outcome. That therefore it is like a call for us to contribute in improving access and contribute in inclusive to build inclusive health system that expect, accept, and connect people with disability and the healthcare services. I think I will stop here. But Agi, is it already the time is up?
Yes, but if you would like to give some closing word before we enter the Q&A session, please feel free.
Um, Yeah, the key takeaways is that we all have same risk to develop disability. Therefore, all of us need to be aware and all of us need to be ready, particularly if the participants here are healthcare personnel. And first of all, I think the awareness of all of us is the most important to bring the changes in the healthcare settings and health system. And therefore, if we are already aware that uh, people with disability are part of our community, and one day you will meet a patient with disability. Therefore you have, or all of us have to be ready to expect that they will come someday, and we need to accept them with the readiness of our skill to accommodate people with disability, and the health service need to be designed as accessible as possible. And also after that, it is essential to stay connected after the care with the people with disability. For example, like to improve the reach out, I mean, the connected here, we can reach out if they face the access barriers to access the healthcare services. I think that's all. Thank you so much for listening.
Thank you so much, Malutfi, for a very insightful uh, point of view and presentation. This is really interesting and probably new to some of us. Uh, and now we welcome your questions and insights, everyone. Please use the chat room or raise your hands. Perhaps if you want to ask directly to our beloved speaker, and our speaker will address as many as possible during the Q&A session. So anyone wants to ask? Anyone wants to volunteer? Raise your hands or just open your mic. It's okay. Don't be shy. It's Well, actually, I'm a bit curious, Mbak Lutfi. Whether we've talked a lot about the systemic barriers of the current problems that people with disabilities faced every day. But are there any specific cultural or societal barriers that particularly impairs or a challenge to people with disabilities in general? Uh, Maybe it's because we're very curious because you have lived here and abroad in London and in Indonesia. Perhaps you might have some insight on the societal and cultural barrier on that.
Thank you, Maggie. Yeah, I believe it's there. The societal and the cultural barriers. I think it derives on the awareness. So, um, if people are aware about disability, I think there will no be like stigma or perception or discrimination or negative attitude because they are aware that disability is part of our life cycle, it's part of our community. It's actually there is no different with any other um, population, and I believe that if people are aware, um, they don't see difference in people with disabilities. Yeah. What difference I face here in Indonesia and in the UK is, yeah, I because of the so in here because of the access barriers, for example, like inaccessible transportation, inaccessible buildings or in infrastructure. I see myself as a person with disability. But then when I live in the UK, in London particularly, where I can be independent myself, I can take any transportation mode, or I can go anywhere by myself. I don't see myself as a person with disability. So that's, yeah, the interaction between the condition and also the environmental is very very real that I experienced that if I don't face barrier, I don't see myself as a disabled person. But here it is a bit stressful because I cannot go anywhere by myself. So I depend a lot to my on my carer. So yeah, here therefore here I cannot do anything by myself. And people see me as I always need someone help. And therefore many people see people with disability as dependent, not independent. I think the way the interaction of the barriers with the impairment is really shape how society see a person with disability.
Wow, yeah, that's a very insightful thing that you have shared. But in our chat room, we have several questions already. Thank you so much, everyone. First question is from Kosasi. For Mbak Lutfi, if you were a policymaker, what would be your top priority for improving healthcare quality for people with disabilities, especially considering the high complexity of their challenges? Thank you.
Um, if I were a policymaker, um, I will have power to make a policy. So I will first have the policy and then be translated into the technical guidance, and the policy itself will also um, help in allocating budget to do any other thing else after translating the policy. I think that's my answer. If I were policymaker and if I have enough resource, I will have the policy first and then allocating the budget and the resource to translate into the um, smaller technical tasks to develop more accessible healthcare services.
Yeah, that's interesting. Yeah, we wish that there is a representative in our policymaker that could create such an inclusive policy for all. Okay, moving on to the next questions from Anggita. Oh, to Mbak Lutfi, what strategies can be implemented to increase awareness and reduce stigma surrounding disabilities in healthcare settings? Oh, that's interesting.
Strategies can be implemented by do you mean did you mean that this is implemented by health facilities itself or by whom? If it is by the health facility itself, I would suggest to healthcare worker training on the disability and also in inclusive healthcare services. Actually, as at the London School of Hygiene at our center, we developed there is a project that conducted training and also trial on this training, but it is conducted in Africa. There is they also develop the manual and guidance. So they still pilot this manual and guidance and the training, and hopefully it can be scaled up to any other countries, and the guidance can be adopted to other setting as well. I think that's my answer. I want to have healthcare worker training, and actually this is also my dream. I teach at the Faculty of Medicine, Public Health and Nursing. I teach medical doctor candidate and also the public health programmer candidate. I would like to give exposure to them to raise awareness that someday your patient will be people with disability, and you have what are you going to do if you have this kind of patient? And I want to give exposure to them, and hopefully it will raise their awareness about this condition in the society. Yeah, but it's still long to go.
That's really cool, and having awareness to students and candidates, medical professional candidates out there might highly raise awareness. Thank you so much, Mbak Lutfi. For Kosasi and Anggita, if you have further question, please just let us know. But we're moving on to the next question from Silva Haryo Saputro. Hi, Mbak Lutfi. I would like to know your experience both in Indonesia and overseas regarding disabilities. How are the people differentiated? Because I don't think that in Indonesia people are really open regarding disabilities. Thank you, Mbak.
Um, in the UK, I don't feel like I am differentiated to other people, so I don't feel like I'm a disabled. But here I feel disabled because I face so many barriers in doing everything. So your statement, I don't think Indonesia people are really open regarding disabilities. Okay, I want to answer this. I want to respond to this statement. So it is like a cycle, vicious cycle. People with disability don't go outside because there is no accessible accommodation, or it is not accessible to go outside. And then if um, if the government or the authorities build uh, like the accessible transportation or just accessible building or build ramps, and because of people with disability tend to not going outside, and when they are not going outside, the facilities will be turned into something else. For example, like it is blocked by parking a motorcycle, or it's blocked by any merchant, and it is like vicious cycle. My experience is that, so in my office in our university, the building has a disabled toilet because it is very long time not being used by someone with disability. The function is changed, so it was storage. And then when I joined the faculty, when I want to use this toilet for disabled, they need to clean up all the storage and yeah, everything. So it's like vicious cycle. We are not going outside because there is no accommodation, but this limited accommodation it's not being used, then we'll change for the function.
Yeah. Oh, that's interesting. Yeah, that's indeed a vicious cycle. Yeah, so That is also a homework for many governments to do. Yes, to create a more inclusive public facility so people with disabilities can go out without worrying, not being able to use such basic necessities, such toilets
Mm.
and such. Okay, so that's your answer, Silva. If you have further questions, please feel free to chat. And perhaps since it's
I
already,
think there is not one.
yeah, there's another one from Nugroho. To Mbak Lutfi, how can healthcare system improve health literacy and early diagnosis for people with disabilities, especially in communities where access to healthcare and education is limited? Wow.
Mm. Mm. It's tough. uh, difficult question.
Yeah.
Even if it is not limited, I think it's still tough.
Yeah.
How can I get this to improve happiness? Mm, I think first of all, it is always started with the governing body and the policy. Um, so the program or the health policy need to include um, the disability needs in the program. For example, like immunization or vaccination program. Um, uh, yeah, the authorities need to also acknowledge the barriers that people with disabilities have and try yeah, I think the root cause of all of the things is the awareness. If the policymaker aware of disability, and if that all of us have risk of being disabled and anyone have risk of being disabled, and the disability face more barriers to access healthcare, I think the priority will be there. I mean, they will prioritize the access. It is not that we ask to prioritize. Just consider us as the part of the society, and um, universal design, I will say. So if it is accessible for people with disability, it will also be accessible for those elderly or for those who have temporary impairment or anyone. Like if people with disability can access that information or that healthcare services, I believe that anyone else can access that service as well. I think the awareness is the most important thing, and how to improve health literacy. Uh, so we need to acknowledge first the barriers that people with disability face. For example, like those who have sensory impairment. I take an example for uh, people who have vision impairment. They probably will be face difficulty in accessing the written or inaccessible format of health information. But if we know how they usually access the information, for example, like using the handphone to read the text, we can provide the accessible format for them to access the information. That's just one aspect about information. Health literacy, um, the health literacy framework has several aspects of the health information. It's not only providing the health information, but also how they can access the information. So there is still a long list of improving health literacy. We need to first acknowledge the barriers first, and then we need to know how they access, for example, like information. And yeah, if yeah, the awareness, I think, the awareness of those who have power or who have the authorities, if they aware, I believe that they will have the willingness to accommodate the barriers and also the needs of people with disabilities. it is actually not facilitating the special needs. I believe that everyone have needs. For example, like if you want to access the second floor, you will need stairs. But then it's different. Uh, the tools different. You will need stairs. For those who can walk, will need stairs. But for me, as I'm a wheelchair user, I will need an elevator. So we have needs, but the tools are different. It's just building the universal that can accommodate most of us needs.
Wow, that's
Yeah,
yeah, that's very tough. Yeah. That, that, that
yeah.
that's that's actually very complex, but you manage to explain it very clearly to us. It's very important, I think, to have to improve the situation for everyone to make healthcare inclusive. I think that's aligned with one of the purpose of TDR Global and TDR Global strategies also. Yeah, but since we're nearing the end of the session,
Can I add something?
oh yeah,
Since
of
I
course.
think since I think most of us here are health professionals and also researchers, yeah, let's take this opportunity just to remind ourselves if so inclusive health system is very, very big and very, very complicated and very long list to do. But since you are here, I just want to uh, ask all of us here just to open our eyes and to just to raise our awareness about disability and that can probably happen to you or yourself, your family, or I'm not praying, I'm not hoping that to do, but it might. It there is an opportunity that it can be experienced by anyone. So we need to be aware of that from this moment. And if you are a healthcare professional, you now from now you need to um, expect that someday you will face a patient with disabilities. And if you struggling to how can I facilitate this patient, I can give you some resources if it is helpful. You can contact me through the email, or if you are researcher and um, trying new intervention or implementing new intervention, you need start by now. You need to start by now to include the needs of people with disabilities, so that the intervention in the future will also accommodate the need of people with disabilities and can be accessed by anyone. I think that's all. Thank you.
Thank you so much. Wow, that's very very insightful. So everyone, if you're interested in knowing more, please feel free to contact us or contact Mbak Lutfi directly, but perhaps to uh, if you have any questions or if you perhaps need an expert to explain more about how to make healthcare inclusive, especially for people with disabilities. And also, wow, we're nearing the end of our session. Yeah, time flies. Well, perhaps before we end this session, mm, I would like to share some good news to all of you. So, we have a giveaway running in our X.com. If you're active in X, we have a giveaway for 2 ebooks, our conference support in maximum 100 USD. So you can just participate in our giveaway. It's simple. You can just scan the QR here or go to our x.com/TDR Global Asia. You might need to scroll a bit because we just posted about this webinar, but we have our giveaway and it will end on September 7th. So there is only 3 days left. Please join our giveaway. And if you want to know more about our events and our initiatives from TDR Global around the world, you can join our newsletter, TDR Global Asia newsletter. You can also scan the QR code here. And also, before we end this session, if you would like to showcase your research and if you're a researcher in our future webinars, please feel free to reach out to us at this email, agitiarapranoto@gmail.com, and we would love to feature your work. If you have any ongoing research papers, something that you might you feel like you want to showcase, please feel free to contact us, and we will arrange it for you. Also, thank you everyone. We have in our chat room, we would like to provide you with an e-certificate for today's session. There's a link that you can fill if you need any certificate. And before we end this session, let's take a good picture together. I think a photo session. So everyone, please open your camera. And we will take a few pictures together to commemorate this moment. So our TDR Global Asia team will help. Okay. Okay. Okay, ready? In 1, 2, 3. Everyone, give your best smile. 1, 2, and 3. Okay, last one. 1, 2, and 3. Thank you everyone for joining this webinar today. The form for your e-certificate is on the chat room. If you need any help, please feel free to contact the TDR Global Asia team on this Zoom. Thank you so much, everyone, and thank you so much, Mbak Luthfi, for the amazing insights.
Thank you.
We are so happy to be here with you. So we hope that one day you can share more about the ongoing research once it's published.
Of course.
Thank you so much for everyone that already joined today. We will see you with more events and more webinars next month, or this month maybe, perhaps, if I'm not mistaken. We'll see. Please kindly check our x.com x.com/TDR Global Asia for more information on our future webinar and events. Thank you so much, everyone. Good night, good evening. Have a fun weekend. Bye.